Probably that.
Yeah.
Just put it on
Yeah.
your hand. You'll remember.
Well, yeah, put on my handle. Yeah, sure will.
And a schedule, that's great.
Okay. Any other ideas we have?
It might be valuable just to, under 21, access to break that down to under 18 as well.
Okay. Yeah.
I'd anticipate there's folks out there that don't have a lot of sympathy for the argument that you have to wait till you're 21, because the current law allows you to be 18, make your own decision, go to a physician, be approved. But this would not allow a parent to make healthcare decisions for their, say, 8 to 10-year-old child. There just would be no way for them to use medicine. And I think you might have more empathy for that than, say, a 19-year-old who has to wait till they're 21. So there's two different issues, 18 to 21 and then under 18.
Well, and that's great. In fact, that brings in the next thing I was going to get to, unless there was more we had to add to the list. If we're a little stopping point, sort of prioritize these about, like, you know, you're talking about your top 3 conversations. If we can add to that, or sort of create a priority list that we've done, is what we value these as, because I think that helps us flush out when we go out of conversations with people, because I'm sure we all are, the effectiveness of our communication and our little elevator speech that we have is imperative. And so picking the most effective, sometimes for the person, perceived for the person, but also just overall the most effective in any scenario would be good to bring up that strikes home. So do we want to talk or Seth, did you have something to say?
I don't know if it's not a good thing to say, but this is the conversation that I've had with a number of legislators, and they're the ones who bring it up. Marijuana is over a $1 billion industry in Oregon. Produces more economic benefits than wheat, which is our #1 official agricultural commodity. When you start messing with any of the infrastructure that has been put in place over the last 15 years to make that huge contribution to the Oregon economy potentially disappear, there are some serious repercussions that go along with that. And that's, to be honest, that's the argument that's held the most weight in the conversations that I've had.
No, I appreciate it.
And actually, Aaron's data that he gave us on the number of cardholders and patients at particular grow sites, the information, when you model it and you look at it and compare it to other types of distributions, it demonstrates that the Oregon medical marijuana grower network is a robust, developed economy. It's what you would expect to see in any mature industry. It doesn't exist right now in the recreational market. So what you're talking about, if you got rid of the Oregon medical marijuana program, is essentially gutting a mature industry at this point. Still growing, still changing, but it's...
And also that money, like it or not, that's directed from this program to other Oregon Health Authority programs, that goes away. The Measure 91 doesn't give that money to Oregon Health Authority for those purposes. People are keenly aware of that.
I'd also like to restate what the bullet point on home cultivation and say Measure 91 possession and cultivation limits are inadequate for medical use.
Okay. That's probably what you said too, just so many coming at me. So thank you. So can you just do that one more time real
Sure.
quick?
Measure 91 possession and cultivation limits inadequate for medical use.
I think Cheryl spelled that out really well on her first walk.
And so in that, thank you. So because I'm running out of list, let's maybe go on and real quick. And how are we doing on time, Cheryl?
About 6 minutes.
6 minutes left.
Yes.
Okay, great. So then what we'll do is, out of these, if everybody, in fact, I'm going to turn it a little bit to see if everybody can see it. And I'm just going to go over, so I'm not trying to ask you to start that. So we can start from the top and work down. And what I want to do is I just want to get a show of hands who feels this is the most important. And then we'll go down with it if that's okay, unless people have that right.
How many votes do we get here?
Yeah. The thing is that we'll go, it's like, if everyone thinks that's the top, then it sort of defeats the purpose. So if we could, what we'll do is that I'm just going to ask who thinks this is the most important. And then you'll say yes or no, who thinks this is the most important, what's next. if that works for you guys, and you get a vote on
Read
each
'em.
round.
It has to be read.
What?
Yeah, you have to read them. We can't.
Oh, I will. Oh, no, gladly. Oh, yeah. No, I just want to check the process, make sure we're all on board for it. So it protects the largest consuming population, i.e. the medical marijuana program OMMP protects the largest consuming population of cannabis. How many people think that's number one? Show of hands.
I'll go one.
Okay, so we got 2 there.
Yeah, that's.
And so then, how many people think it's maintain genetic diversity based on medical versus the profit model of recreation? I know that's right. If anybody wants to have it be less butchered, sure, feel free. How many people agree with that? Is the number one priority? No one? Okay. Reduce the cost of medical marijuana supplemented by recreation. So this is just cost reduction. It's cheaper, it's less expensive for the medicine for patients. How many people think that's number one? Just speak out to the benefit from medical marijuana. Okay. That's no one? Or one person? Okay. And then reciprocating medical states for the ability to travel interstate with medical marijuana versus recreational in many more medical states than there are rec states.
That's a good idea, but it's gonna light the legislators up that oppose the program.
Yeah, exactly. Yep. So that's a go. And so then identification and maintaining a high standard of care. So said that.
It's being able to identify the patient population, how many patients are in the program, what type of medical conditions they use it for, and then allowing the medical care industry and treatment to be catered towards this population we've identified.
Okay, anybody for that? And then two. And then patients under 21, and specifically also the additional patients that are minors that are under 18 that need to go. So how many people in favor of that one? So 1, 2, 3, 4, 5, 6, 7, 8. 8. Okay, and then that the OMMP is already a self-funded program with $7 million contributing to multiple other programs by $1 million. That's 1,
Yeah.
2,
Don't legislators listen to
3,
that?
4,
Yeah.
5. It's like,
And it's amazing how many legislatures have absolutely no clue that that's the case.
Wow.
yeah.
You keep talking about let's consolidate it for economic reasons without that information.
And so then amount of patients that receive free, so basically it's the amount of patients that receive free or reduced marijuana based on having a medical marijuana card. Okay. Just strictly the medical benefits of marijuana, medical marijuana. Basically appealing to people saying that your appeals, pretend you're talking to legislatures, say, this someday you may have neuropathic pain, someday you may have this, the benefits of actually consuming it as a medicine with low side effects,
Is that what was talked about on the education and research or not?
No, that's just strictly saying, it is part of it. It's basically what you're saying is it's not just education. It's educating everybody to say, yes, it's not just a recreational to get high. It actually does have medical benefits. And to focus on the medical benefits. So 2 there.
Was that education and research you just
No,
did?
that's just
Oh.
strictly focusing on saying these are the medical benefits.
Oh.
It could be tied in, of course, to educating legislature about it, but just basically saying what the direct medical benefits of it are as a promotion of the legislature.
You have to be more specific, I think.
Yeah.
Oh yeah, you'd have to. That's what I'm saying. You'd have to have some specificity, and even if you have the specificity, that's why it's. We're just asking, So that's what got brought up. Qualifying for other reduced programs. So in other words, that the people that, of course, they're in the recreational market, there won't be qualifications for patients to receive fee reductions. This allows for fee reductions and also obviously reduced expense of patients. back to the reduced cost. It's called. Any hands for that one? No, one hand, okay. And income tax revenue, which then, so the income tax revenue, so basically, which ties into sort of this last one a little bit, which is, so these two are, so basically the combination of income tax revenues and the flip side of that is be very careful messing with a mature industry that already returns $1 billion a year to the state of Oregon.
Yeah, that's.
That's a,
very
anybody
compelling.
raise your hand on that one?
Yeah.
So I think we got sort of
I'll be one on
universe,
that,
so the good news is, one just became really easy, right? So this is number one, right?
Mhm.
It sounds like, and it sounds like running second is the access for minors, correct? So this is number two. And then it looks like we're at number three is that the OMMP is already a self-funded program with $7 million and lots of assets. Okay, so now we can go down the list, but I think these are real strong top three. Does any, yes?
What happened to Todd's, the one my number one was, the possession and cultivation limits are inadequate for medical use.
It's
Yes.
here, didn't I say it?
That was Todd's last point, which I thought is
I
really
think,
number one.
And that was like one of the first ones I had on my list
Yeah,
too.
we put it on.
It's
Didn't I?
certainly
Is number
important.
one.
Possession, yeah, possession, it had one. A major 91, possessing cultivation limits inadequate for medical use. So I got
Well,
one
it's
vote.
just the way it's worded, it's backwards. It should
Oh.
say patients need more as opposed to.
Patients need more, so patients need more
Yeah.
plant counts to,
Then there's available in 91.
exactly, it's available to 90.
That was my.
Okay, so
that
all
one,
those in
and
favor of
under
that one?
Yeah,
Please
add
raise
that
your
one
hand.
in there too. as
Yeah.
well.
Was your number one.
What?
There's some commonality to some of these.
Absolutely, a lot of these morph into major categories.
Together.
Yeah, exactly, so now, what we're doing is we're starting to see,
You may want to, because Era didn't clearly hear the one that taught you about the measurement, you may want to get a hold on that again, because our work.
yeah, we can write it up again. What I'm gonna do is I'm gonna erase a couple of them here that are,
Just
don't
take
have.
one of these artwork things and start writing.
Yeah, just start doing it. Actually, you wanna take a, yeah, take, oh.
The
good
newly
man.
painted walls.
Selfie.
Is that
Color's gonna show up.
Look where I'm at. So, there you go.
And thank you, oh. He's the man, as usual.
Thanks, Angie.
We're 2 minutes over 12, Ben.
What?
We're 2 minutes past 12.
Oh, we are 2 minutes.
It's not a crisis, but.
It's so officially, here's what I'm gonna say, is officially we can adjourn for lunch, but anybody who would like to stay a couple minutes, I say it's really valuable, so.
So then you extend our lunch longer.
What?
Just extend our lunch
Yes.
longer. We stay longer.
Yeah,
to do
we
this.
extend,
That
yeah,
means
we extend that, yeah, exactly.
So I think a couple need to be
Yeah.
combined, but I think you need to go back and Todd, state what you really meant and see the votes on that, because I think people missed that one.
And I think so too. I think what I'd like to do, if it's okay, because in fact, what I'm gonna do is Cheryl, this is where you can come in handy with your penmanship. And spelling, and we can go on for days, but I think I'm gonna pass the baton. So why don't we get, if it's okay, maybe get clarification to 1, 2, clarification of 1, 2, and 3, and this, and they may start to morph in. So let's talk about number 1. That's what I'm thinking. I'm thinking, yeah,
I think
that's,
number 1 and 2 goes together, and then identify that Todd statement, because it's actually number 1 on.
you need 1 and 3, be careful
Yeah.
with this, and the funding.
Exactly.
but-
Yeah,
Because that's
So-
almost together.
Exactly,
So you
exactly.
can tie it
So
in.
That would
let's,
be
so
one.
1 and 2, so let's just for a second flesh out how we want that to best be worded.
So it's a self-funded program with 7 million, and it also is a mature 1 billion return industry.
Yeah,
So you
yeah.
can sum it up.
Exactly, yeah. Direct funding to, yeah, self-funded, providing direct, benefits to other, over $7 million in money to other programs. And it's a $1 billion industry, agricultural industry, the largest, the number 1 in the state. And then I'm sure, I love that mature, that was a great,
Yeah, that's
that
a
was,
good word.
yeah, high five, no, I'm just, it's just,
Oh, come on, Seth.
The data indicated.
yeah. Well, thank you for being a good vessel for that information.
See if that says it.
Self-funded program benefits.
Other OHA programs is mature and changing it will lead to negative repercussions.
I like that don't mess with the $1 billion industry. I like the cash in there personally. I like the $7 million direct to other agencies, and I like the don't mess with $1 billion industry. When you say $7 million in direct funding, yeah, the numbers are a lot to people. You know, for me, you know, yeah, and then I think, what do you guys think about having included in also the $7 million? Is that that's an accurate? It's actually over.
I have no idea right now.
Yeah, but it's approximately. You can say it's
Well,
conservative.
how much was in the bank for the
The average is that?
The
Oh,
cash balance
Yeah.
last
Seven, so let's just say 7 million. And he was just saying, you have
6 million was the most, for the last 2 years, the average was 6 million per year, but right now it's 4 million.
Okay.
How about this, medical marijuana program drives research and education?
Well, I think let's stick with number 2, which is not the
Patients
medical-
under 18.
Yeah, exactly. Patients under 18 piece.
How do I say that?
So let's work on that together.
No minors, retail or recreational
Yeah.
use does not take into account those with medical conditions and concerns under current
Yeah.
use under the age of 21.
Actually, Aaron, the way he worded it is that they would be removing protections from people who are currently protected under the law.
Oh, I like
Yeah,
that.
Aaron, why didn't you speak up? You gotta have crazy.
Thank you, Tracy and Aaron. Yeah. Thank you both.
And I was kind of thinking about kind of lumping them into like patient access and then economics and, you know, kind of taking these and
Breaking them down.
sorting them categories.
No,
That's how my
I like
That
that,
sounds good.
and I like how it sounds really good. And I think that's really what it is for us, to each one of us sort of look at the highlights and think of this as our elevator speech, right? So in each one, there's gonna be individual conversations, and we gotta hone in on what those, like you said, in each main category.
Patient protection to me is the.
Yeah, and then whereas we know the legislators are gonna, this is more obviously tailored a little more to, like, which is gonna be our focal target audience right now, you know?
Between 18 and 21 within.
I know, I'm just saying, for example,
Okay.
because that's more compelling than the 18 to 21, as Aaron said, you know, the kids that just want to get high, they're faking their way to the car. So those are the categories, I'm just putting it there.
And then if they get rid of the, you know, if they get rid of the medical program, then the whole Charlotte's Web thing, like in Colorado, can't happen in Oregon.
Yeah.
Or you have Iowa funding it, they're saying you can have it, but you can't get it.
My phones at my office have just went down, and I need to use my cell phone to communicate with codes and people, so I have to tap out.
Okay, well, thank you so much for coming, Michael. Sorry about that technical difficulty. Thank
I'm
you.
sorry, I just want to let you know why I was leaving. Bye for now.
Thank you.
What else?
And this is Jerry. This is Jerry Thorberg. I'm piping in and out as my patients come and go, so I'm tuning in at this point, and I'll try to tune in later at lunch too.
Okay, thank you so much.
Thank you.
So, looking at the third one, which we talked about, is that basically the measure 91.
Patients need more.
Yeah, exactly. Patients need more, need greater amounts at more reasonable prices than legalization will afford.
I did that.
Yeah, so right then. So, and now I do, after we put this, because we now are 10 minutes after. And so what I think at this point, this will give us a good food for thought. We'll get this down, we'll craft and create something and get it out. And I guess now we are going to adjourn for lunch. Be back here at 1:10.